Hello, everyone, and welcome back to the Brass Tacks podcast. Today, I'm super thrilled to have Monica Unni on. Monica, welcome. Thank you so much for being on the show.
Thank you so much for having me. I really appreciate it.
A little bit of background about Monica, everyone that's listening. Monica Unni is a seasoned physician assistant and the owner of Loop Wellness Clinic. She has locations in downtown Leesburg and Old Town Alexandria. She brings over 17 years of emergency medicine experience from West Virginia and Inova Loudoun before transitioning into a functional medicine and wellness practice. At Loop Wellness, she focuses on bioidentical hormone management for men and women, primarily in their 30s to 80s, especially those in their mid-40s. The clinic also offers IV therapy, nutrition programs, food sensitivity testing, medical guided weight loss, M-Sculpt, Emcella, and NAD shots, among many other services. Monica's commitment to personalized and proactive care truly sets her apart. So I'm so excited to have you on, Monica, and learn more about you personally and professionally. So thanks again for being on.
Yeah, well, I'm excited. Thanks a lot.
Yeah. So tell us a little bit about yourself, Monica. And I mean, obviously, like in your intro, I know you've had a lot of experiences in emergency medicine, but kind of give us a little bit more background about yourself and kind of why you wanted to start Loop Wellness.
Yeah, so I am a longtime resident here of Leesburg. I moved here, gosh, when I was in my 20s, right after I graduated from college. So my husband and I live in Hamilton. We have 3 lovely children and 3 dogs, and so I feel very much ingrained into the community, and so I spent most of my initial career here at Inova Loudoun in the emergency room. And, it is true what they say about the emergency room that after some time you do get burnt out. And I loved what I did, but I was tired. And I did notice that just consistently and historically, I was the one provider that was always spending the little extra time in the room, which in an emergency room setting is not necessarily a good quality to have. And that was always the feedback of like, hey, can you just shave down your visits just a little bit so that we can get a little bit more productivity? And so it was a constant theme. I always felt like I was transplanted into the wrong environment because I was a little bit more attached to the patients that are not technically my patients. They're supposed to be in and out, right? You're not supposed to see them again. You're not supposed to have continuity of care with these people. And so that really had me thinking like the last almost like 7 to 10 years I was in the ER, like I don't know if I'm doing the right thing. I don't know if I'm in the right field. And so I literally spent like those last handful of years really exploring, what my strengths were and what I really wanted to do. And I did have a passion for trying to figure out more the bottom line of like, what are these patients like ailments? What is the real source to their issues? And I started digging deeper into the functional wellness arena, whole health wellness, and that's kind of started my journey down the path that I am now. And interestingly enough, it was actually a patient that I encountered in the ER years ago. I was suturing her up. So when you're suturing, depending on the depth of what you're suturing, you're in there for quite a while with these patients. And so I was in there for a long time and I was just chatting with her. And she was telling me about hormones and her pellet therapy. And I was intrigued and I was interested. And so after that encounter, I just started doing my own research on what in the world she was even talking about. And so that just piqued, I would say, a sidebar interest in hormonal management. And I just kind of spent my own time researching, doing more. And that was one of the things that resonated with me when I chose to open up my own practice. When I made my decision that I did want to do more. I wanted to serve my community better, and how could I do it? And what branch of medicine did I want to practice in? And so that's kind of what started that whole journey, and then how I opened up Loop in Leesburg.
Glad you brought that up. I find that is becoming a common theme, not only in the medical, with the medical community, but even in my field as well. Like in chiropractic, so many associates that I've been interviewing now are just like, They're feeling like they're having to see more and more and more and be rushed with more patients and more patients. Is I know in the ER it's very, fast paced and you're not supposed to continue care with your patients, but any of your colleagues are they also experiencing that even if they're not in the ER, if they're in, just normal private practice or in other hospitals? Do you feel like is that a common theme amongst all industries, or did you just feel like it was just because you're in the ER?
I think that that's a common theme in Western medicine. I mean, I would say that that's the downside that patients see, and they don't like that 15-minute window where you don't really have the opportunity to really address all of your complaints. And if you have more than one complaint, you need a separate appointment. I would probably say practitioners feel the same way, but that's just the philosophy of, I would say, how medicine is practiced. And that's probably part of the reason why so many primary cares want to go into concierge medicine. It's not just about a different pay structure. I mean, that's probably part of the incentivization, but I think it really boils down to those practitioners want to spend more time with their patients, and you're not allotted that time. And so in the emergency room, I think it's understood and expected. I mean, it is supposed to be fast paced. And so that's a different, a different ball game, I would say, and an expectation that I think is important to follow. You do need to be fast paced, but yeah, I would say it's a common theme amongst both practitioners and patients that they don't like that 15-minute window. But I don't think I don't know if there's a way to avoid that, because it is all about insurance and revenue and getting people in and out the door. So, but
And what are you
I don't have to deal
noticing?
with that.
Right. And what are you noticing now that you have your at Loop Wellness and you have more time with patients? What changes have you seen not only with your patient outcomes, but you yourself as a practitioner? What types of
Yeah.
things do you enjoy?
So I love that question. I will tell you that that is probably what I love the most about what I do. One, because it is my practice, I can do what I want to do, and I can spend an hour to an hour and a half with every single patient. The only person that I'm answering to is my office manager who's knocking on the door because I'm running late. Because I am spending that time, and my goal in that window of time is to really get to know the person that is sitting in front of me. And I find that invaluable, and really listening to what all of your complaints are, because I feel like I have an important job to do in that 1 hour. So you may have a list of complaints, or you may have just a few complaints. And my objective in that 1 hour to 1.5 hour is to, one, educate you on what I'm doing, what we offer, and how hormones may potentially help you. But it's also my job to screen what your ailments really are, so that I'm not just placating you saying, yes, hormones will fix that. But in reality, you actually have a much deeper issue, a much deeper complaint or diagnosis that requires actually a different type of intervention, requires you to see somebody else that is not me. So it's really kind of assessing you and ensuring that you are the right candidate for hormones, and that you don't need something else to help manage your complaints. But so yeah, it's been amazing, and I would say that that consultation piece is the best part of what I do.
And for somebody that's hearing, bioidentical hormone management for the first time, can you go in more depth about that? Kind of how that can, because I know there's a lot of, hormone replacement therapy, hormone management. There's a lot of different types out there. Can you explain to just our listeners kind of what type of difference you've seen in your clients and in their health and in their everyday life?
Sure. So, kind of a couple of questions in one, but I would say just a general level of understanding is that when you say hormone management, it's a big umbrella term. And there's a variety of hormones that we're kind of addressing in that one term of hormonal management. So we're looking at potentially testosterone for men and women, and then we're looking at estrogen potentially, progesterone potentially, thyroid. So all of those are hormones. So when we're saying hormonal management, we're kind of putting all of those into one umbrella. But then as we're assessing you and talking to you, we're kind of developing and determining which hormones are you a candidate for. And then also, hormonal management encompasses both synthetic hormones as well as bioidentical hormones. And so I think as a prospective patient, when you're doing research online and you're trying to figure out, what any of this means, and what hormone maybe you're a candidate for, I don't think the internet does a really good job on making that distinguishing factor of the information it's giving you, is it pertaining to bioidentical hormones versus synthetic hormones, and there is a difference, and the difference really is about just the chemical composition of that hormone and your different side effect profiles to those particular hormones. Bioidenticals tend to have just a safer potential adverse reaction platform. So that's where I'm more of a proponent for bioidentical hormones, just because your risks are different and side effects are different.
And I know you guys, are you guys still with Biote? Is that who you still
Biote
use?
is,
Okay.
yes, is the company that I use. They have a tremendous amount of support and research, and they're really on this wave of functional medicine and whole health. So it's a great company to partner with, and it's really just centered around the support that they can provide.
Okay. And so I know you've got a lot of other services as well, which I definitely want to get into, but sticking with the hormones and the therapies that you guys, what are some of the most common things that, people come to you with, that are seeking for, hormone management?
I would probably say the most common complaints are energy, lack of energy, just feeling run down, mood changes. I'd probably say it's easier if we separate this into men and women. So for men, I do find that their complaints typically are centered around stamina, energy, workouts, motivation. And I would say that men aren't necessarily the most forthcoming with sexual health complaints. So sometimes, yes, they have all of those other complaints, but they either have a drop in their libido or maybe even some performance complaints. And so, but those tend to be, I would say, the more common complaints that men have. And a big one, which I mentioned, but when I say like a decline with like their workouts, like they can tell that their stamina has dropped, and the effort that they put in doesn't translate to their body. So body composition changes, not as much lean muscle. So those are usually what men will complain of. Women, it's actually a wide range of complaints for women. It can center around the same issues as far as energy, stamina, and mood. The mood a lot of times is a disruption centered around their menstrual cycles. So enhanced just moodiness, agitation, irritability, low tolerance with children and husband. You'll get a lot of the perimenopause, menopausal complaints as far as hot flashes, night sweats, vaginal dryness, brain fog. Low libido tends to be a very common complaint for women as well. But I'd say those are the highlights of what a lot of women complain of.
And so when you have these men or women coming in to see you and they do opt to to do some bioidentical hormone replacement, what are typically how long does that take to see results? I'm sure results are different for everybody, but what are the things they typically notice first and then more long term, kind of what do they see in their health changes more long term?
Sure. So it's a great question. It depends on what modality we're using. And a lot of times when I say that, a lot of patients are like, what do you mean by modality? And there's different ways that you can administer these hormones. And so if we're looking at like a topical route, cream or gel, or if we're looking at a sublingual route, which is a lozenge, you may see your results a little sooner. So it may take, anywhere from 1 month to 3 months to start to notice some symptomatic benefit. When we're looking at pellet therapy, which is implanting the hormone into your subcutaneous fat, it takes longer. That is definitely a much longer process where it can take weeks for your levels to slowly rise to the point that you are feeling the notable changes. But there's significant benefit and value in doing pellet therapy. So if you just step back and you hear that and you're like, well, why wouldn't I want that route that I'm going to get kind of that instant gratification? With that comes compliance issues. So the ability to be able to remember to apply, that cream or take that sublingual lozenge every day or twice a day can be really challenging for patients. And when you're placing the hormone in your subcutaneous fat, even though it is a much slower process and slow rise to your level, compliance is key. You're treated for men twice a year, for women every 3 to 4 months. And the premise of pellet therapy is that it's just a steady state to your hormone level. So once you're treated and your levels are in sufficient range, you just live there and your levels just stay there, opposed to levels going up and down with topical or sublingual therapy. But so it just depends on the modality as far as how long it takes to get that overall benefit. I'll tell you that with pellets, I see about, let's say, 130 to 150 patients a month. and I have a 90+% retention rate. So even though somebody may be saying, gosh, it can take 3+ months for me to really feel solid with pellet therapy, I would say that the retention rate translates to the fact that 91% of patients, even though it takes time to get them there, they feel great once they're finally there.
And then long term, some of the benefits, does it tend to kind of, do you have more of that consistent, steady level of testosterone or, when you do administer it that way long term, as long as they're sticking with their treatments?
Correct. So
Hmm.
as long as you're remaining on therapy, you will continue to see those benefits. I would say it's a very dynamic and interesting way that pellets work at the back end of your treatment cycle. So for men, if you're at a treatment cycle every 5 months, usually around 4.5 months, you'll start to feel a subtle drop. Your energy is a little bit noticeable as far as a decline. Maybe your workouts aren't as great. Mood is shifting just a little bit. It's a little reminder that you are doing something to help augment how you're feeling. And a lot of patients need that reminder because it validates what they're doing. It validates the fact that, oh, I need to go back in for my treatment. And so that is usually what happens for most patients. So women at that 3.5 month mark, they'll start to notice maybe a subtle return of their night sweats in the middle of the night. Libido is not as good as it used to be. And so once you're retreated, levels kind of come right back up. And within 1 to 2 weeks of their treatment, it's forgotten again because they're back to their kind of new baseline.
Wonderful. And one thing I didn't know, Monica, which I think you did teach me about, was some of the associated conditions of just like long-term low testosterone. Can you touch on that a little bit? Just if people like, it's not just energy and libido and working out and things like that, but if we have patients that live with low levels of testosterone for long periods of the time, what's the research showing that they can end up
Yep.
can yeah.
Yeah. So usually what I tell patients is that there's two lanes of benefit when you're looking at optimizing your testosterone. You have all the symptomatic benefits, but what patients don't realize is there are a lot of disease and health prevention benefits when you optimize your testosterone. And so low levels of T can contribute to dementia, Alzheimer's, cardiovascular disease, diabetes. For men, increased risk of prostate cancer, erectile dysfunction, metabolic syndrome. So there's a lot of conditions that you are at risk for by keeping your T levels, I'd say suboptimal or below the threshold of a normal range. And so same thing with women. There's some really good research that validates improvement to your bone density. So there's two reasons to say, hey, you know what, I am going to keep my testosterone levels higher.
And then are there any other recommendations you give to your clients if they're doing pellet therapy, if they're doing the oral lozenges, things like that? Any other diet recommendations you give them or exercise recommendations when they are doing hormone replacement therapy?
So a lot of times it's centered on what their complaints are. And I would say that one of the primary complaints for both men and women are weight. And so, which is really the top 3 to 5 complaints for patients when they came in and they were seeking hormones. Those complaints are really what allowed me to grow and expand in Loop and offer these ancillary services. It was to really kind of help patients well rounded with all of their complaints. And so the patients that do discuss weight and are complaining about weight, I tell them, the testosterone will help, and the testosterone will help with energy, stamina, workouts. You can get a greater caloric burn with your workouts when you're being managed with testosterone, but it is not a direct correlate for weight loss. And so guidance as far as, hey, is there something else that you need to do while you're on testosterone? It really just depends on what your complaints are. And so then that opens up a whole different avenue and conversation when patients are addressing weight. I like to be very transparent. One of the biggest, I would say, goals during that consultation is really level setting the expectations. And with the complaints that you are addressing with me, I'm going to let you know in turn, what do I think this hormonal treatment is going to do for those particular complaints? And so weight is then a whole different avenue of conversation, which is, hey, do we need to focus more on just nutrition and fine tuning what you're doing, tracking your foods? I have Allie Burton, who is my functional medicine nutritional nurse, and she is phenomenal Hormonal, and everybody gets a complimentary consultation with Allie. And that then is a different segue for nutrition and trying to tackle what their particular complaints are, and then how can we address it, and are there other weight loss modalities that we want to then add to what you're doing.
And so transitioning into some of the other things you offer at Loop. So you mentioned weight loss. You guys also do IV therapy, inflammatory food testing, even the NAD shots. So
Mm-hmm.
if someone was to come to you, Monica, and they've got a whole list of symptoms, how do you determine what treatment's going to be best for each one of your clients?
No, that's a good question. It's a hard question to answer. But I would say first and foremost, it's really about listening to the patient and then helping them prioritize why are they here and what is number one, two, and three, and then based on what that one, two, and three is, then we tackle it in that manner. That okay, so based on what your complaints are and your top priorities, hormones will address this. If it is weight, and weight loss is one, two, and three, it doesn't mean that they can't be done in tandem, meaning that we can't manage your weight and manage you hormonally. But if cost is a factor, then we help figure out, well, which way do we want to navigate this, and what do you want to do first, second, and third. But from a weight standpoint, then once again, it really does boil down to trying to meet the patient where they are at. So not every patient is looking for medication to help them facilitate their weight loss goals. And so that is where I would say we do stand out with what our abilities are, and with Allison, and how we can help patients maybe restructure what they're doing and really help them with their diet, a specific nutrition program that does not focus on medication. And then the patients that are looking for something a little faster, we do have an all natural supplement line, along with a very, very, very rigid diet plan that we really help track you with, using a specific like anti-inflammatory foods, low glycemic index foods. And it's a program called Thinner, and patients can lose anywhere from 10 to 25 pounds in a 6 week time period, but very guided by us in the practice. And then we do offer prescription medications for weight loss as well. So we really do try to kind of meet a patient where they are at and match them with where their needs are.
And I wanted to touch on your NAD shots, your IV therapies. Like, obviously, if I was coming to you and I said, "Hey, I've got low energy or I'm not working out as much," how can you determine whether you want to say, "Oh, okay, this patient might be a candidate for hormone replacement, or maybe they just need to do some IV therapy or some NAD,
Mhm.
or are those also done in conjunction with your hormonal therapy?"
They can be done separate. They can be done in conjunction. I would say the scenario you gave is a lot harder to answer, because fatigue can be a big problem, that really needs to be analyzed, and labs need to be evaluated, versus, hey, I'm just feeling a little run down and tired. And if that is more of like a moment in time and I'm a little exhausted, IVs can absolutely help. I would say the same thing for even hormones. If you're coming in saying, "Hey, this past couple of weeks, I've just been really exhausted and run down," my answer wouldn't be, "My gosh, we should stick some testosterone in you and get you going." I mean, uh, so it's more, I would say, analyzing what your issues are and what your complaints are with a little bit more depth. IV therapy can be very, very beneficial for patients that just have a little slump in their energy, or they really want maybe a little bit more gas in the tank because they've had a heavy workout. They're training for a marathon or Ironman. IVs can work beautifully with those patients. I would say patients that suffer from inflammatory conditions, autoimmune conditions, they'd be a great candidate for cycling IVs every month, or even twice a month, to help with inflammation and to help with a little bit of energy. Um, there are a couple of ways that you can tackle low energy, but I would say the more important piece to that is assessing first. Um, because energy can be, like I said, energy can be a bigger issue than something so superficial as to say, let's give you some B12.
Right.
Um, Let me see. We have an immunity bag that helps boost your immune system. We have recovery bags that has some a good amino acid blend that helps your muscles recover. So there's definitely value in getting an IV.
Yeah. And I wanted to bring up, because Jasmine will kill me if I don't, the MCella and the M Sculpt that you guys offer as well. Can you tell us a little bit more about what those how those services can benefit your clients?
Yeah, I sure will. I actually forgot to mention NAD, because that can be tied into energy. But NAD is it's a great, great I would say, a modality that we have recently added to the practice. NAD is a coenzyme that your body gets deficient in as you age, and it really helps in the anti-aging process. It helps with cellular regeneration and can help with energy. So I'd be remiss if I didn't add that into the energy talk. Oh, Jasmine is 100% correct. So I would say our little valuable secret gem of the practice is our Emsella chair and the Neo, which has kind of a new application to it. And so I'll talk a little bit about that. But so the Emsella chair is a chair that is designed for urinary complaints. So it's a game changer for urinary incontinence, stress incontinence, urge incontinence. And it's non-invasive treatment. You sit on this chair completely clothed, and it helps with essentially tightening up your entire pelvic floor. So it uses high intensity electrical waves. You sit on this chair for 28 minutes, and it is equivalent to thousands of Kegels in one treatment. And so the premise really is like tighten up your pelvic floor, and it will help significantly with incontinence. It's a package of 2 treatments a week over a 3-week time frame, so 6 treatments, and you should see improvement within that 3rd to 4th treatment with incontinence.
With the Emsella chair, and then the other one was the M Sculpt. Is that what the Neo?
Yes. So the M Sculpt Neo, so I'm super excited about this. So the M Sculpt Neo has been out for a good handful of years. So BTL is the company, and BTL had the M Sculpt for years, and it was out and marketed for muscle enhancement and fat reduction. They came out with kind of a newer technology, and that is the Neo M Sculpt, which is different than just your traditional, and was supposed to work more aggressively for the muscle enhancement and fat reduction. And we've had great success with the fat reduction, and patients will report significant improvement to muscle and strength. But so they have updated their technology with this machine, and there is what we call a functional application to the Neo. So we're targeting specifically joints, and we've seen some significant improvement when you use it in tandem with even patients that are like coming to you, or patients that are doing physical therapy. You place the machine on their particular joint. You're using a radio frequency, so gentle heat, and you're using high fem, which is that those electrical pulses. When you place it over the joint, it's enhancing blood flow, it's reducing inflammation, and it's helping with osteogenesis. So it's helping with bone formation. And so you see significant improvement to tendinopathies. So like your golfer's elbow, tennis elbow, osteoarthritis. So you see improvement even post-surgically with range of motion for any ACL repairs, meniscal repairs. So it's been a great modality that we've added to the practice just recently.
That's awesome. I'm glad you have all these wonderful wellness modalities. In your opinion, Monica, now that you've been in practice for a long time, what do you feel is some of the biggest misconceptions people have about, functional medicine compared to just, your traditional healthcare type model?
Misconceptions. Gosh, I don't know if I would say there's a lot of misconceptions with hormones.
Okay,
And
about hormone. Then let's say about hormones. Yeah.
yeah, because I do think from a standpoint of, your traditional practice and functional medicine, I think patients are more aware and intuitive and are seeking functional medicine practices out because they are aware that there's more out there for them. But I would say the biggest misconception is really centered around hormones and testosterone and estrogen. And I think that there's still a fair amount of patients and unfortunately practitioners that are not necessarily informed and educated on all of the benefits that testosterone provides, and that we do want your testosterone levels higher for both men and women. And it's a calculated level of higher, placing you in a safe range that provides symptomatic benefit and disease and health prevention benefits. And I think there's just a lot of, like I said, misconception and misunderstanding on the safety surrounding that. And I still think that there's a lot of women out there that don't know that they should be managed with testosterone. I think that there's a lot of men that find it maybe demasculating to think that they need testosterone when the treatment can be well beyond sexual function. It can just be really about mind, energy, mood. It doesn't always have to be sexual health reasons that you want to optimize your testosterone.
And if I've had, I feel like not a lot, but I've had a handful of people who, not with the pellets, I've never had it with the pellets, but I've had a handful of people come to me who have gotten testosterone shots and had very bad side effects. Like one client even told me like it had rapid like heart rate or just
Mhm.
felt very. Is that due to the type of shot you're getting, or some people just have bad reactions to testosterone versus the pellets or the BioT that you guys provide?
So, to be fair, I think that you have the potential to have a poor response to testosterone, period, no matter the modality, if it's not managed and treated properly, and if your dose isn't accurate and appropriate. So, I think it'd be unfair to say that's only centered around injections. There needs to be there's an art and science to what we're doing. And so there is that delicate balance. I do feel like with injections, maybe patients aren't tracked as closely as they should be. And I think that those side effects can be very much more noticeable and acutely felt if your testosterone dose as an injection is too high, because it is rapid onset, and that is, I would say, one of the benefits of injections is it is a night and day difference between a pellet. So with a pellet, we're saying, hey, you got to hang in there and wait about 6 weeks before you start to feel, the benefit. And then it's a slow, steady rise, where with an injection, it's like instantaneous gratification. You feel really great. You go up, you kind of plateau a little bit, and then you come down. And if that dose is too high, yeah, you go up and you can feel aggression, you can feel palpitations, you can feel jittery. So a lot of that is dose dependent. But once again, it's you can have, I wouldn't say it's similar to that degree, but even with pellet therapy, topical therapy, sublingual therapy, you need to go to the right place because
Yeah.
you can have poor dosing no matter what you're doing.
So if someone's interested in getting hormone replacement, obviously everyone you got to go to see Monica at Loop. But like, are there any red flags, or how would a person know that they're getting enough, or what should their provider be telling them? Are there any signs or things that the provider should be telling the patient when they're getting hormone replacement that, might be a red flag to be like, oh yeah, they might not be monitoring the level, they might not be administering the correct amount, or
I would say that if you're going to a place that isn't checking labs, that should be your
okay.
flag number one. And I would say you should feel that you have been heard and listened to, and any potential side effects that you might think you're experiencing should be once again heard and listened to. So if you feel like you're not being valued with what your complaints are, and even, I have patients that will get treated and they'll have maybe a slew of concerns after they're treated. And I would say it's so important to hear what those concerns are. I may know right out of the gate that it has nothing to do with the testosterone that you've been administered, but that patient does need to be heard and then given an explanation as to, why it is or is not related to their treatment. But so I would say that if you don't feel heard, then that should be your second big flag. But labs should be checked periodically. There's a lot of patients that are losing weight from different modalities. And so like those patients that are on GLPs and are losing weight pretty quickly, their hormones should be very much tracked and your dose is very much weight based. And so if you're going to a practice that is still treating like clockwork every, if we're referencing pellets, treating like clockwork every 3 months, that should pose a big flag too, because that's just a great way to stack your levels and have some issues down the road. So weight based is a big deal too.
Got it. So everyone who's listening, you want to make sure that they are monitoring you, getting lab work done, making sure that your levels are where they're supposed to be at, not just continually administering you more and more and more
Mhm.
without checking and getting labs done.
Yes.
Awesome. Well, I love that you have all these cutting edge modalities. And as wellness becomes, the wellness industry becomes more and more popular, what are some things you do, Monica, at your office to just stay ahead of the curve? And obviously, you've got things like MCELA and the NEO and hormone replacement management. Are you constantly just like researching new stuff, or how do you kind of stay ahead of the curve and be so innovative at your practice?
I would say continued education. That is the only way that you can stay ahead of the curve. And so I was actually just last night looking at a potential conference that I might go to with Dr. Morgan Tyler, who's like the guru of testosterone management. So it's really just staying abreast of the research that is out there, and conferences are the best way to do it so that you can kind of stay ahead of the curve.
And now back to you, Monica, because I know how long has Loop been open now?
Loop has been opened for, okay, what month are we? Like the February. Loop has been open for 5 years. I want to say if it was six before. Yep, five. So we hit our fifth year in February, and it's been a wild ride. It sometimes feels like it's been like just last year, and then sometimes I feel like it's been a lot longer than 5 years. But it's been, I would say, an amazing 5 years.
And how do you balance it all? Because now you've got two locations, you've got three kids. Obviously, your practice is thriving. Are there any non-negotiables, anything that you just have to kind of keep on your schedule to keep your sanity, or what do you do to kind of manage both
Oh
offices
my
and
gosh.
stay on the edge of this?
So honestly, I stay sane because of my team. My team is awesome. And so I have a fantastic nurse practitioner, Erica Schilling. And so she really helps balance me, balance practice, and then really truly the team. I have a great team starting from my three nurses and my office manager, assistant manager. So it really is. It's the team that helps me stay sane and balanced. But then it's really my family, my husband. Kind of is that little reminder to be like, hey, you need to take a time out here for a second and just breathe.
How often is your team getting together? Do you guys do pretty consistent trainings, or is there any specific qualities you look for when you're hiring new team members?
So, up until now, I've been blessed to literally kind of cherry pick all of my team members. And so all of my nurses, I worked with in the hospital. And so it was just like, I know you're fabulous and I know your work ethic and I know how smart you are. So yeah, I was able to literally pick my team members like that. Um, so we do have office meetings once a month, and then when certain conferences come up, I'll decide, who's really like the best candidate to help tag team this with me or do it independently. And then we do try to actually, I kind of took a page out of your book, and so we do try to do like a bonding scenario every 3 months. And so we just actually put two more on the books. I think one is coming up. Surprise them with, and now they're starting to give me their ideas and suggestions. So puppy yoga is on the highlight for what they are really hoping I'm going to do for our next bonding. But yeah, we try to get together and just kind of get out of the office every couple of months.
And what do you feel now that you've been in practice for 5 years? What's the most rewarding part or the most fulfilling part of having your own practice?
The patients. So, I mean, I can even just picture a few in my mind, but the ones that really do say, "You've changed my life. This has been life changing." That's rewarding. That is why we do what we do. Our goal is to really help patients feel their, and honestly just listen to them. And if we're not the practice for them, that's absolutely fine, as long as they feel like they were heard, listened to, and educated, and then I can help guide them in a different direction. But yeah, it's the patients.
And if somebody's, interested in getting their hormone levels checked, or if they think they may have a hormone issue, what advice would you give them? What's the first step they should take?
Labs. Labs. That is the first step. And so, typically what happens with us, you call our practice and they'll kind of screen you for what are you interested in? What are your complaints? And it's a very just baseline superficial screen, because our goal isn't to send somebody down some wild goose chase of getting labs if that's not really what they're looking for. But then we kind of just guide them with what our process is, but it's lab work first in tandem with them filling out the intake form. And then we schedule an appointment with myself or Erica, and it's an hour-long appointment, and the goal really is that we address all of your complaints and review your labs and discuss what our options are, and if hormones are what they're ultimately looking to do, and if they're looking to do pellets, we can treat them that same day if they desire.
Wonderful. What's new? What's coming up in the future for Loop Wellness? Do you guys have anything in the next few months or the rest of the year planned?
We're going to be doing a promo for the functional piece to that Neo. So really, we're going to be targeting patients with joint issues. So post-surgical, or really looking. I'll probably reach out to the pickleball community. Everybody's got some elbow issues coming up, as now they're going to start playing outside more. So we're going to do likely some kind of promo in office event to really tie in that functional piece to the Neo.
Awesome. All right, wonderful. Well, anyone who's listening, Monica, can you tell how should we get in touch with you? How can they find you? What's the best way for somebody who's looking to come see you? How can they get in touch with you?
So if they go to the website, www.loopclinic.com, they can get all of the information there. They just need to give us a call or shoot us an inquiry through the link on the website, and they should get a phone call within the same day. I would plug my telephone number, but I don't even remember it. So yeah, if you just go right to the website, you get a lot of good information there. But literally, there's two ways. Just send an inquiry through the email or just give us a call, and then we'll take it from there.
Wonderful. Well, anyone who's listening, I definitely recommend checking out Loop Wellness. I have been there. Jasmine has been. I've sent staff to you even
Yes,
when my
which I
staff
appreciate that.
when my staff is getting groggy. I'm like, go over to Loop, Monica, get an IV, get a shot, whatever you need.
Yes.
To anyone who's got staff or a team and they are frequently tired or sick, I constantly am telling them you got to take your supplements, you got to get your IVs. So thank you so much for being on, Monica. It's been an absolute pleasure speaking with you, and we look forward to talking soon.
Okay, take care. Bye bye.
Bye bye.